Hello, you're welcome. Today we're discussing Eustachian tube dysfunction. Before we talk about Eustachian tube dysfunction, let's just look at the anatomy of the Eustachian tube. So we're saying Eustachian tube, which is also known as a pharyngotympanic tube, is a tube that links the nasopharynx to the middle ear. So it is also part of the middle ear. Okay. Now, what are the functions of the Eustachian tube? Saying number one, ventilation of the middle ear cleft. So it plays a major role in equalizing middle ear pressure with the atmospheric pressure. Number two, prevent reflux of nasopharyngeal secretions. Number three, clearance of middle ear secretions. Okay, now let's look at the diagram of the ear. Okay, so this is the diagram of the ear. This is the diagram. This is showing the ear canal, the eardrum there, okay, the middle ear, and the Eustachian tube here. Okay, this is the other diagram of an ear. Okay, it's showing the external auditory canal, the tympanic membrane, and the Eustachian tube here in the middle ear. Okay, there's also the inner ear in blue. Okay, now what is the Eustachian tube dysfunction? So you're saying Eustachian tube dysfunction is the inability of the Eustachian tube to regulate properly the air pressure in the middle ear. This also includes the ineffective drainage of secretions from the middle ear cleft. Okay, so now what are the causes of the predisposing factors? Saying nasal allergy, chronic infection in the nose and the sinuses, the change in altitude like flying in a plane, and also nasopharyngeal tumor, and many more. Okay, so what are the signs and symptoms? Okay, so there is hearing loss, which is most likely to be conductive, feeling of fullness in the ear, dizziness in some patients, tinnitus, pain, popping sensation, and many more signs and symptoms that may not be included here. So what are the investigations? So you can do an otoscopic examination in which in the early stages it might appear normal, but in severe cases you might observe a retracted tympanic membrane. And you can also do a CT scan, okay, an audiometry, tympanometry, and a nasopharyngoscopy, and many more investigations. What treatment can be given? So antihistamines like cetirizine can be given, and also give steroids like fluticasone, and also advise the patient to practice a Valsalva maneuver in which the patient will try to exhale the air, but while the nose is pinched so that it's closed and the mouth is closed, while the air which was supposed to come out through the mouth and the nose will be forced to pass through the Eustachian tube in order to help equalize the pressure. And also we can also give some local decongestant like xylometazoline. And also an auto vent can be advised. Remember, this treatment can only be done after the advice of the health practitioner. Okay. So Remember, this channel is not a substitute of school and the hospital. Okay, so if you have these signs and symptoms mentioned, visit the healthcare practitioner. Until next time, bye bye.